Ladies and gentlemen, my greetings to all of you who are practicing excellent medicine in your communities. I'm very happy always to know that doctors like you are providing the state-of-the-art medical care to the patients and their families in your respective communities. And that is the reason why you are well recognized for your services to the community in the field of medicine and also in the prevention of disease and in maintenance of public health. So you are all the guardians of the public health of this great country, because unless our citizens are healthy, the rest of the progress has no meaning. And in fact, we cannot make any progress as a country unless our citizens are in good health. And I would think that you are the gatekeepers of good health for the country. It is an immense responsibility you have and an important privilege you have as a result of your medical education, postgraduate training, and tremendous clinical experience in private practice as well as in academic practice. So to you, I offer my salutations and extend my support always to do what is right for the patient so that the whole country remains healthy and continues to contribute not only to the region, but also to the world, which will be dependent on good health of our citizens. One of the risk factors for chronic illness in our country, as you know, is hypertension. Hypertension is an important forerunner of complications such as coronary artery disease, congestive heart failure, peripheral vascular disease, chronic kidney disease, end-stage kidney disease, cerebrovascular disease. All systemic complications are related to uncontrolled hypertension. Fortunately, hypertension can be diagnosed without much expense. It can be diagnosed without much investment in technology, and it can be diagnosed quite accurately in clinical practice. And you can make the diagnosis of hypertension based upon the current guidelines, both Indian guidelines as well as the global guidelines for hypertension. So now you're in a position to make a rapid and correct diagnosis of hypertension in your own clinical practices. Once you make the diagnosis, then obviously you will assess the patient for the presence of any target organ damage or dysfunction and for any secondary causes of hypertension. And then you would render appropriate treatment, which could be non-pharmacological treatment, lifestyle changes, plus tremendous therapeutic choices we have to control hypertension. The treatment of hypertension now has changed quite a bit in the last few years. At the present time, we have the ability to treat hypertension with great precision and with great accuracy, and you can reach the goal levels of blood pressure in every patient that you see in clinical practice. So now, at the present time, you can make the diagnosis without any difficulty, and you can assess the patient, and you can order appropriate therapeutic investigations and do proper profiling of the patients, and you can tailor the treatment to reach the goal levels of blood pressure based upon the clinical status. So the entire spectrum of hypertension, ladies and gentlemen, is in your hands, and the society is depending on your hands to diagnose and to treat hypertension successfully for the benefit of the patient, their families, of the community, and of the country. Now, to assist you and to update you on the current status of hypertension, academic medicine, the current views on hypertension, the current opinions on hypertension, the current research in hypertension. We are coming up with 6 volumes of Hypertension Reviews. Hypertension Reviews is a periodical that we're publishing for your benefit this year, and it will be coming up in 6 volumes. And each volume has very important articles on every aspect of high blood pressure. And these articles in the Hypertension Reviews are written by topmost experts in the world, what I call them as top tier, grade 1 experts in the world. So it's basically, you're going to see the cream of hypertension researchers, cream of hypertension academicians who are being asked to participate in writing understandable, clinically relevant articles for Hypertension Reviews this year. And it is going to be delivered to you in 6 volumes with different themes throughout the year. I hope that you will take time to read these Hypertension Reviews, which are discussing the actual state of art of hypertension, written and assembled by world-class hypertension experts from India and from abroad. So I'm very pleased that I've been asked to serve as the editor of the Hypertension Reviews. And when I read these articles, it has been an immense pleasure to me that how nicely they are written and how clinically they are relevant to practitioners. So again, I would like to suggest that you please look forward to receiving these Hypertension Reviews, and please give some of your valuable time to go through each volume. And if you have any comments, questions, or suggestions, I hope that you will bring it to my attention without any hesitation so that we can further improve them in the future. So, ladies and gentlemen, again, this is kind of a earlier snapshot to inform you that this year you're going to get Hypertension Reviews in 6 volumes, which are easy to read, easy to assimilate, and importantly, easy to apply to the benefit of your patients. So please accept my good wishes for your continued contribution to the health of the community and of this country. Thank you very much.